this is Victoria Smart, and today I'm going to be assisting a patient in repositioning in bed. First things first, this is our patient. This is Ted. Say hi, Ted. He's the best. I'm going to verify my provider's orders. I'm going to enter the room, perform my hand hygiene, ensure patient privacy, and introduce, hi, Ted, how are we doing? Myself to him as well as to his family if they are present. I'm going to explain what we will be doing to him today, and then I'm going to position him into a supine position. I'm going to make sure that if he has any pressure areas, that they are relieved, and then I'm going to place the bed all the way down to a good working height for myself. Next thing, I'm going to position him in a supported Fowler's position. So I'm going to elevate the head of the bed, or I'm going to put a pillow underneath his head, and then I'm going to position a small pillow. I also have my towel rolls here. You can use a small pillow or towel rolls. I'm going to, if needed, put a towel behind his lumbar section of his back, and then I'm going to use pillows to support his arms and hands. I'm going to place a pillow roll underneath his thighs, and then I'm going to support his calves as well with a pillow or a towel roll. I'm going to place pillows at the ends of his feet, making sure that they're aligned and maintaining dorsiflexion. And then next I would be positioning him into a supported supine position. So let me remove my towels. And then for this, I'm going to make sure that I'm going to lower the bed and lower the head completely flat or as tolerated for Ted. I'm going to place him down here. And I'm going to remove his pillow. I'm going to place a small towel underneath the lumbar area of his back, as well as behind his upper shoulders, like so. And then I'm going to place small pillows underneath his forearms, making sure that the upper portion of his forearms are parallel with his torso. I'm going to place sandbags, so rolled towels or sandbags along his upper thigh area and legs. And then I'm going to make sure that I put sandbags parallel to the lateral side surface, not on the inside, but the outside. Next, I am going to be positioning him in a 30-degree lateral position. So I'm going to raise the head of the bed. So let's get raised to 30 degrees. And then I'm going to lower the side rail in the position, him on the side of the bed, facing opposite of the direction that he will be turning in. I'm going to move his upper trunk first, and when I'm doing that, I'm going to support his shoulders. And then with his lower legs, when I move those, I'm going to support him at the hips. I'm going to raise the side rail and move around to the other side, the opposite side of the bed. I'm going to flex his knee that is not along the mattress. And then I am going to place one of my hands on his hip on the other side, and then roll him on his side towards me. Next, I'm going to place a pillow underneath his head and neck. And then I'm going to place my hands under his dependent shoulder and bring his shoulders forward towards me. I'm going to position both of the arms slightly flexed. And then I'm going to support his upper arms by placing a towel and making sure that his upper forearms are parallel with his torso. I'm going to place a pillow underneath his flexed upper leg and to make the level of the hip and groin to the foot. And then I'm next going to be positioning the patient in a Sims position, or sitting. So I'm going to place him back into a supine position, laying flat. I'm going to ask for assistance, and with the help of a stationed nurse or assistance on the other side, we're going to move him towards the side of the bed, facing opposite of the direction that he will be turning in. I'm going to tuck his arms, so we'll go this way. I'm going to tuck his arm underneath the side that he will be turning, and then I'm going to flex his knee that is not up against the mattress. I'm going to turn him onto his side, and then I will position him in a lateral position, lying partly on his stomach. So a little bit on his stomach. I'm going to place a pillow underneath his head for support. And then I'm going to place a pillow underneath his flexed upper leg. I'm going to make sure that all of his personal items are within reach. I'm going to make sure that the call light is within reach. I'm going to make sure that I leave the room clean and tidy, and I'm going to follow up as I go along with Ted's comfort level, making sure he's not in any pain or nothing's not aligned, creating pressure on him. I'm going to then dispose of all my materials that I used. And then I'm going to perform my hand hygiene and remove my gloves, obviously, if I needed to don gloves. And lastly, I'm going to document and report his response to the treatment, how much he was willing to help me, if there was any pain, lightheadedness experience, and then any unexpected or expected outcomes that I have. I'm going to let him know when I will be back to check on him, because he should be turned every 2 hours. And that is it.